Meeting the woman for the first time. This video demonstrates a social and emotional assessment and screening for domestic or family violence, also known as intimate partner violence, at the woman's initial visit with a maternity care provider. The video will be broken into 3 stages: assessing social and emotional well-being, the Edinburgh Postnatal Depression Scale, and screening for domestic or family violence. We know that social and emotional health problems in the perinatal period contribute to poorer outcomes for women and their babies. In New South Wales, the Supporting Families Early policy directs midwives to conduct an assessment and screening for all pregnant women at the initial visit and in the early parenting period. In New South Wales, the Antenatal Risk Questionnaire is used to detect the presence of social and emotional risk factors. New South Wales also has a set of standardised domestic violence screening questions. Both sets of questions have been integrated into the initial visit. This video starts after the standard medical, surgical and obstetric histories have been completed and as the social and emotional assessment begins.
Well, thanks Martina for going through all those questions. I know there's a lot of them, but it's really important for us to get a good history so that we can plan appropriate care for you. Now, we've gone through your family history and your medical history, and at this point in time there are some questions that we'd like to ask the woman on her own. So Chris, I'll ask you to go out to the waiting room, and as soon as we finish this section I'll pop back out and get you to come back in.
Sure. Okay.
Assessing social and emotional well-being.
Okay, Martina, these next set of questions are about your emotional well-being. We ask all women the same questions during pregnancy because we know that sometimes things that have affected us in the past will come back to the surface at this time. So these questions, although they may not seem immediately relevant, they give us an opportunity to identify areas where you might need additional support, because we want women to be in their best health, both physically and emotionally, when they start their journey into motherhood. So Martina, when you were growing up, did you feel well supported by your mother or your caregiver?
Yeah, definitely. My mum has always been a great support. Yeah, she's great. She lives in Queensland, but we talk every few days, and she's hoping to come down for the birth or when the baby comes so she can give us a hand.
That's great.
Yeah, if mum can't come, then my eldest sister might come. Yeah, I'm pretty close to my family.
Okay. Where's your eldest sister?
She's in Queensland too. Yeah, one of them will come for sure.
Excellent. It's always good to have a bit of additional support at the time.
Yeah.
Okay, so the next question is about whether you've had a period in your life of 2 weeks or more where you've felt very anxious or very depressed.
Sort of, I guess. Well, you know, Christopher just lost his job about 2 months ago. So with the pregnancy and that, it has made me feel a little anxious, just about finances and stuff. But he's looking for work and he's happy to do anything. He just needs to find some labouring or something.
Okay. I understand that would be quite a worry with Chris not working.
Well, it's just that I won't get any paid maternity leave.
Yeah, I imagine it's very stressful. We can offer the services of a social worker. They're able to talk through some of the financial supports that are available to you and your partner as you progress through the pregnancy.
Yeah, I think we'll be fine. I reckon he'll be able to find some work.
Okay, well just keep that in the back of your mind. You know that service is there should you need it.
Okay, thanks.
Chris is pretty stressed, not having a job at the moment. Do you feel that he's been able to provide you with some good emotional support this pregnancy?
Oh yeah, he's great, definitely. Yeah.
That's good. And he's come along today with you, so that's a good start.
Yeah, well, he's not working at the moment, so it makes it kind of easy.
Yeah, I guess so. So the next question is around, in terms of the last 12 months, apart from Chris losing his job and not currently working, have you had any other major emotional stresses, such as changing jobs yourself or moving house or maybe a death in the family?
No, just Chris's job.
Okay, that's good. The next question is around how you're coping. Would you generally consider yourself a worrier?
Only if there's something to worry about, like Chris losing his job. I've been waking early and sometimes it's taking me a long time to get to sleep.
So what are you doing about that?
Generally trying to not drink coffee during the day. I've been doing some yoga, breathing and relaxation. Having a warm shower and drink before bed.
They're great strategies. If the trouble sleeping continues, it might help if you're able to talk with someone about your worries. So just keep that in mind. The next question is around support in general. You've talked about having mum in Queensland and your sister. Do you have other people around you that might be able to provide support during the pregnancy and around the time of birth?
Yeah, I've got my friend Rosemary. She is a great support. She's given me lots of baby stuff, and she said that when we get closer we're going to talk about the labour and that.
That sounds really good. You said you were working. Remind me what you do.
I work at a news agency.
And so have you got people at work that might be able to support you?
Yeah, I work with Rosemary. Yeah, so yeah. And I was playing netball, but I'm not allowed to play now that I'm pregnant. But some of the girls from netball are a good support. And there's friends from Chris's rugby. We have the barbecues and drinks, but I'm not drinking.
That's great, that's great. We know that there's no safe level of alcohol during pregnancy, so most women choose to abstain at this time, and that's what we recommend.
Yeah, sure.
Okay, Martina, this next question is about when you were growing up, whether you experienced any form of abuse. Some women find that pregnancy and birth can bring back some negative feelings for them in relation to past experiences. So you said you felt supported growing up, but did you experience any emotional, any sexual or any physical abuse?
No, my family is big but close and very supportive. No abuse.
That's great.
Edinburgh Postnatal Depression Scale.
Now, as a follow-on from the questions I've just asked you, and again it's questions that we ask all women, it's around how you've been feeling emotionally. It's an indicator for us as to whether or not you're at increased risk of depression. If you score high, it doesn't mean that you have or are going to get depression. It just means that we'd like to keep a closer eye on you and on your emotional health as you progress through the pregnancy. So Martina, it's a series of 10 questions, and it's about how you've been feeling in the past 7 days. So if you have a read of the questions, and if you can circle the answer that most corresponds to your feeling, the feelings you've experienced in the last week. Okay, Martina, thanks for completing that for us. I can see that your score's quite low, so that's good. As I said, it's just an indication as to whether we need to offer you additional support. If your situation changes, we might get you to repeat it, and you'll also be offered the chance to repeat it again after you've had your baby. If you do feel your situation's changed and you need additional support, please let the midwives know. We know that during pregnancy, your emotional health is just as important as your physical health.
Screening for domestic or family violence. Midwives need to be prepared in case a routine screening leads to disclosure. Conversations about sensitive issues, such as women's experience of abuse and domestic violence, can be difficult to both initiate and undertake. There are a number of key practice points in relation to screening for domestic violence. They are: explain to the woman that the inquiry about domestic violence is a routine part of all women's antenatal care. Do not blame or judge the woman or her partner. Take a holistic approach and offer appropriate support. This may involve a referral to other health professionals specifically trained in the area. Assess the safety of the woman and any children in her care. Document the discussion in records that are not readily accessible by the woman's partner or family. Seek professional support to improve your skills in screening and working with women experiencing domestic violence.
Okay, so the next set of questions are questions again that we ask all women, and they're around domestic violence.
Jeez, there are a lot of questions.
Yeah, there are, but we are nearly there, and these questions are really important because we know that 1 in 4 to 5 women experience domestic violence during their lifetime, and unfortunately for us as midwives, the rate of domestic violence increases during pregnancy, and sometimes a partner who previously hasn't been violent will become violent at this time. So the first question is, in the last 12 months, have you been hurt, slapped, hit or hurt in any way by a partner or ex-partner?
So not the last week, it's the whole year now, is it?
Yes, this is the last 12 months. Have you been experiencing some violence?
Well, he's not violent. I wouldn't say he's violent. It's just that, well, if we've been at the rugby barbecues and there's been a bit of drinking afterwards, sometimes if we get into a bit of an argument, sometimes he's just a bit, like he's a little bit rough, that's all. Nothing, I wouldn't say he's violent.
Martina, can you tell me a little bit more about what you mean when you say he's a bit rough?
Well, he gets fed up with my nagging.
So does he hurt you?
No, he doesn't hurt me because I'm pretty strong. He just gives me a little bit of a push.
So it's physical?
Yeah, in the last year, it's happened a couple times in the last year.
Okay, so have you ever needed to seek treatment because of the violence?
No, never. I don't think he means to hurt me. It's just, I egg him on sometimes and he's always really sorry.
Yeah, I know this is really hard to talk about, and unfortunately it happens in a lot of families, but it's not your fault. No one ever deserves to be physically or emotionally abused.
Yeah, sure. It's just that he says I nag. I nag too much and I don't give up. I just keep needling him, which may be true.
You know, Martina, there's never any excuse for violence against women. You do know that domestic violence is a crime, and I just need to know, have you ever needed to call the police?
No, I haven't, because I don't see it as violence, and it's probably the drink.
Yeah, it's still not acceptable in terms of how people should be treating you. And I need to check with you, in terms of going home today, do you feel safe to go home?
Oh yeah, I do.
So, if the violence occurred again or got to a level where you really had to get away, do you have a plan in your head?
No, I'd probably call my mum. Mm-hmm. My brother doesn't live far away. And Rosemary, I could go to Rosemary's.
Okay, so there's also the domestic violence support line. It's a confidential service that you can ring and talk to anyone at any time, and they should be able to help put in place a strategy to make sure that you're safe and that your baby's safe. They'd also be able to point you in the direction of the closest safe house for you to access. Also, if you need to, you can always call the police and they will intervene.
Okay, it wouldn't be bad to have the number or some info on the helpline.
Okay.
Not that I think it will happen again, but
Yeah, it's good to have it just in case. Okay, so Martina, this is the information. On the inside is a little bit about domestic violence and what constitutes domestic violence. And on the other side is the helpline here, and also some information on some services that might be of assistance to you as we go forward. So I'll give you that. Chris doesn't need to know that you have it. Okay, Martina, I just need to check at this point in time, do you need us to intervene around this?
No, I think it'll be fine. I think we'll be fine. Only hiccup was losing the job. So, yeah, we're really looking forward to having the baby.
As I said before, we do have the services of a social worker that we can put you in touch with to both assist with maybe some financial services that might be available and maybe making a plan around ensuring that you and your baby will be safe.
Yeah, that might be good. Will they want to see Chris too?
Look, it's up to you, Martina, but it might be an idea for the first time to see the social worker on your own. That way, if you do want to discuss putting a plan in place, then you'll be able to do that just seeing them on your own. Look, I'll contact the social worker and let her know, and she'll give you a call and make an appointment.
Thanks, Rachel.
Okay.
Thanks for that.
I know it's really hard to share such personal stuff, so thanks for sharing that.
Thanks. Yeah, I think we'll be fine. We're planning classes and we're really looking forward to the ultrasound in a few weeks.
Look, just remember we're here and we're available if you need us. Don't hesitate to contact us. So, do you think we're ready to go and get Chris back in the room?
Yeah. Do you think you might be able to talk to him about the ultrasound? I think he might be a bit worried about what's involved.
Oh, absolutely. Let's go and get him, eh?
When social or emotional issues or abuse and violence are identified, midwives need to work with the woman to identify strategies and support. This may include offering referral to specialised support services. Midwives need to approach all the assessments positively and, when necessary, adapt their practice to ensure the woman feels safe and supported at all times.